Good afternoon. Good afternoon and welcome. I'm Susan Kelly, President of the City Club. Welcome to another special program, this time focusing on an issue in which Oregon, unfortunately, leads the nation, and that issue is hunger. Our experts today will examine the issue and talk about what can be done to improve the situation. They are Rachel Bristol, Executive Director of the Oregon Food Bank, and Patti Whitney-Wise, Executive Director of the Oregon Hunger Relief Task Force. I hope everyone today has remembered to bring a non-perishable food item to place in the barrel at the back of the room. On Friday, March 7th, join us for a program focusing on the inner workings of City Hall, and our guest speaker is Gary Blackmer, our elected city auditor, and that program will be here at the Multnomah Athletic Club. Our annual membership drive is well underway, and after our spirited kickoff last week, we had 25 new members sign up. So please note on your table today, those of you that are not members, are cards and information, and I hope you'll consider joining. I know our guest speaker, one of our guest speakers' husband just joined, so we're happy to have those new members. Our board host today is Kurt Wabering, member of the Board of Governors and second vice president of the club. He will ask the first question of our speakers. And following Kurt's question, we'll open the program to questions from City Club members in the audience. Please line up behind the mic even before Kurt is finished so we have time to ask as many questions as possible. Identify yourself as a City Club member and keep your question to 30 seconds, please. We also have some guests from Dignity Village, and we would like to extend those wonderful guests an opportunity to ask a question if you would like, but it's the 30-second limit. Thanks. Broadcast of City Club programs this quarter is made possible in part by our corporate underwriting from Kaiser Permanente, Nike, and Washington Mutual. Rachel will be our first speaker. While not quite a native Oregonian, Rachel was raised in the rural towns of Washington and Yamhill counties from the age of 4. Rachel graduated with honors from the U of O with a degree in community development and public administration. She began her work in hunger relief as a VISTA volunteer with Oregon Food Share in 1983. She wore many hats and had many titles in this organization, which formed the first statewide food banking system in the nation. That's a good Oregon first as opposed to where we're first in hunger. She served as acting executive director in 1988 and played a key role in the merger of the Oregon Food Share with Interagency Food Bank, the regional distribution center for helping agencies in the Portland-Vancouver area, and that formed the Oregon Food Bank. Rachel was named executive director in 1990. In her role as executive director, she has guided the development and implementation of numerous programs to respond to diminished food resources and increased community needs throughout Oregon and Clark County. Oregon Food Bank is recognized as a national model for its coordination of hunger relief efforts in 37 counties, which was a surprise to me. I didn't realize how broad this is. And its active role in working with policymakers and the public to address the underlying causes of hunger. Rachel has served on the Legislative Task Force on Hunger Relief and is a member of the Community Action Directors of Oregon, the Human Services Coalition of Oregon, and numerous national task forces on hunger issues. She served on the board of directors for America's Second Harvest, a national organization working with 189 food banks and food industry donors throughout the U.S. Patti Whitney-Wise was born and raised in Salem, Oregon, and attended college in California at the University of San Francisco, where she majored in sociology. She remained in California for the next 25 years and returned to Portland, you said, in 96. She entered the arena of public policy on food and hunger issues in Oakland as a VISTA volunteer in 1976, specializing in child nutrition programs. In 1977, she joined the staff of Children's Rights Group, where she coordinated outreach and training workshops in the Western regional states on all federal food programs. She later worked for the Food Law Center and then became executive director for the California Council of Churches, expanding her scope to poverty issues in the state and federal legislative arenas. When Patti, with her family, moved back to Oregon, she worked for and is now the executive director of the Oregon Hunger Relief Task Force. Currently, she is helping to track hunger in Oregon and to coordinate public and private nutrition program services, as well as advising legislators and other public officials on solutions to hunger and poverty. Please welcome our guest speakers.
Thanks, Susan. It's great to be here today. I have to say that today is the last day of my 20th year with the food bank. So I'm especially pleased that hunger is on the agenda of the City Club today, and promise to start working hard on my 21st year tomorrow. I wanted to tell you a little bit about the Oregon Food Bank Network and how it works. As Susan said, a lot of people don't really know that we cover the entire state of Oregon as well as Clark County, Washington. We really do have a very unique national model where 800 nonprofit organizations throughout the state and Clark County have agreed to work together to share the food resources available so that if a person is hungry, whether they're in Ontario, Coos Bay, Bend, or Portland, they're going to get similar types of foods that are available. The network has also set priorities for how we share that food. Last year, that was a total of 55 million pounds of food with a value of $75 million. Delivered throughout every county in Oregon by a network of volunteers. First priority going to programs that meet emergency needs. Those are what in our world we call emergency food pantries, soup kitchens, and shelters. Folks that are serving families who are not able to meet the needs of their family, their shelves are empty, turn to food pantries and receive a 3 to 5 day supply of food. Soup kitchens, I'm sure you're pretty familiar with, serving up hot meals day in and day out, the largest of them here in the Portland area. And then shelters for battered women and runaway kids. The emergency food agencies make up about 60% of our network. And one of the things we've heard a lot about in the media recently is we just, if we just had more volunteers and more community support and more support from faith-based communities, we can get on top of our social problems. Here in Oregon, of those about 500 emergency food programs, 70% of them are operated in churches, synagogues, and mosques. So here in Oregon, the faith-based community really is the heart and soul of trying to ensure that no matter where you are, that you have access to one of the basic human needs, and that is food. Those agencies collectively bring our communities together, donating more than 1 million volunteer hours every year in the distribution of food. There are some who say, and I'm one of them, that perhaps we've done such a good job with the charitable system in Oregon, we've created a complacency. The general public hears so much about this incredible volunteer effort. I think it's sometimes easy to believe that the hunger problem has been taken care of. I'm going to talk a little bit about how we got to our ranking of #1 in the nation for hunger, which is an indication that the charitable system really cannot fill the gaps that are left by the public safety net. An example of that is in looking at the statistics of our statewide organization. Over the last 5 years or so, our network, an Oregon Food Bank, has doubled the supply of food that we are distributing. Last year, 55 million pounds of food. At the same time, the requests for emergency food assistance have grown by 70%. So while the food supply has doubled, what it's translated into is somewhere between 3 and 4 more days of food for a hungry family. On average, the same household receives 3 food boxes a year. We hear story after story when we talk to emergency food clients about top ramen months. That's what they're filling in with. After they spent some cases it's $10, some cases it's $200 worth of food stamps. They put together top ramen with whatever vegetables and extras they could get through a food box. And the mom and the kids are eating top ramen for breakfast. Mom is taking it to lunch at work, and that's what they have for dinner. And by the end of the month, the mom is no longer eating breakfast, and the mom is no longer having lunch, and she's only eating dinner after the kids have eaten. That is true for hundreds of thousands of people in our state. Last year, more than 720,000 people ate out of an emergency food box. When we look at who those people were, 40% of them are kids, 17 and younger. We talk a lot about our school crisis. Part of our education crisis is also that there are nearly 300,000 kids in Oregon and Clark County, Washington, that are going to bed hungry, that are having to rely on charitable food assistance for just a little more help. And there are many national studies that have shown the direct link between a child's access to adequate nutrition on a regular basis with their ability to learn. Kids who don't have adequate nutrition have a much higher dropout rate. They have much lower test scores. They have a much higher absentee rate because of illness. And they have much higher behavioral problems. So as we think about our school crisis, we also need to be thinking about the hunger crisis and the ability of our kids to learn. When we look at the adult population, often people will say, well, if they would just go out and get a job, there's lots of jobs out there. And we know that's not true today, but even in the 90s, as we had the lowest unemployment rate, we had the highest hunger rate. 42% of the households have at least one member working. Many of them have 2 adults working. More than 30% are 2-parent families. The adults who are not working are retired, disabled, or taking care of someone who is disabled, and the remaining 25% are actively looking for work. Take a little closer look at those folks. A third of them don't have a telephone. A third of them have no access to transportation. This is from a statewide survey that the Oregon Food Bank conducts of emergency food box clients every other year. So getting and maintaining a job are very difficult. Part of the reason Oregon has the highest hunger rate in the nation is because of our rural nature, because of our reliance and now lack of reliance on our natural resource-based economy. We have lost essentially all of our family wage jobs in the timber industry, many in farming, agriculture, the fishing industry, which up until the early 80s and then a continuing decline through the 90s provided family wage jobs throughout rural Oregon. And most of Oregon is very rural, so our challenges are even bigger because of that. Oregon has the most rapidly increasing rate of poverty over the last 2 decades of any state in the nation. We also have the fastest growing gap between the top 5% of our population in terms of income and the top fifth, the top 20%, and the bottom 20%. During the 90s, the top 20%'s disposable income grew 38%. The bottom 20% income dropped 14%. More and more people have become employed, but the jobs that have replaced those family wage jobs in the timber industry and fishing industry are primarily service sector jobs. They primarily are minimum wage. Often they carry no benefits. In fact, most of the people who are receiving food boxes that are employed have no health care. Health care is another major factor of why people are turning to our emergency food system. I think that's about my 10 minutes, so I'm going to stop now. We'll have lots of time for questions, and Patti will tell you a little bit more about this phenomenon that is true not only in Oregon, but in the Northwest, in the Southwest, in the states that have been reliant upon agriculture and timber, are those who are the hungriest in the nation. Thank you.
Well, since Rachel took some of my comments, I get to do the one we talked about with a hand chart. One of the other things in terms of housing costs, just to add to what Rachel has talked about in terms of the wages going down, because even outside of the timber industry, we've been losing manufacturing jobs. Those averaged around $41,000 a year, and service industry averages around $25,000 a year. So we have people working, but they're working for a lot lower wages. And at the same time, over the 90s, a phenomena that happened in Portland that also happened in the rural area, but we have a chart, and I'm going to try to do it with my hands for you. Wages went about like this, just slightly up in the Portland area. Housing costs went up, let's see here, wages, housing. Okay, so you have housing costs going up this much and wages only going up this little elbow amount. Well, you can see how people might have a harder time putting food on the table. If they're paying that much more of their income for housing, that leaves little left for other things. I want to take us back a little further just for a moment, because I think it's really important for all of us to have that historical perspective. And my career goes back to the mid-'70s, and so I was around for a wonderful child nutrition reauthorization in 1978, where we were really able to expand child nutrition programs, only to see many of those things cut in 1981. In 1981, the budget that was passed that year at the federal level included 80% cut in subsidized housing, 35% cut in food stamps and child nutrition programs. And at the time, many of us said, oh my gosh, those kinds of cuts are going to lead to homelessness and people hungry, unlike we've seen. And I give to you today, look at the number of homeless shelters, the number of people hungry today. Obviously, one event doesn't have the full impact, but you can see how over time those direct hits on very crucial safety net programs have had a major impact. So, we know that even in the 80s, the safety net had been frayed to a certain extent. Zip forward now to 1996, when we had welfare reform. Many people didn't realize that besides the major changes in welfare, that again, food stamps took another major hit in that particular bill. And interestingly enough, shortly after welfare reform was implemented here in Oregon, we began to see the numbers at the food bank go up dramatically and continue to go up. Now, I often refer to hunger as the canary in the mine shaft. It's indicative of much deeper problems in a society, because hunger is the one flexible item, or food is one flexible item in the budget many times. You've got the landlord knocking at the door for that rent, and the utility companies threatening to shut off your utilities if you don't pay the bills. But you don't have the grocer at the door saying, why aren't you coming in and buying food from me this week? That's really the one flexible area where if the car breaks down and that's your only way to get to work, you're going to fix the car, and maybe your family's going to go a little hungry, or they're going to try to find that food box program or that soup kitchen nearby. So it really There are many other issues. There are income issues, obviously. The income issues are the biggest. So let's look at a hypothetical family just to bring this home a little bit closer. Mary has 2 children, and she works full-time at a minimum wage job. She had a really good year. There was no time off for health care or vacation, so she actually worked 52 weeks at minimum wage full-time, earned about $14,000. Luckily, her rent's only about $500 a month. That's pretty good for the Portland area for a 2-bedroom apartment. You're lucky if you can find something like that that's in decent shape. Now, back in the late 70s, before all of those subsidized housing costs, there would have been some subsidized housing to help her out a little bit. But as it is, she's paying full rent because we have very little subsidized housing left today. And that rent equates to about 42% of her income. Oops. The poverty level says you're only supposed to be spending 1/3 of your income on housing. But Mary's spending 42%. There's already money being taken from some of the other parts of her budget. And then she's got $400 a month in child care costs. Oops, the poverty rate never thought about child care. When the poverty rate was put together, it was based on a family spending 1/3 of their income on housing, 1/3 of their income on food, and 1/3 of their income on everything else. They assumed one parent stayed home with the kids. There was no child care figured into the poverty rate. So we can look at our growing poverty rate and think, oh my gosh, but in fact our poverty rate is much higher. Remember welfare reform, we put all those single parents back to work. They've got this enormous child care cost that they're sharing in. We did subsidize child care. We used to do a better job of it, but in this last year, even those subsidies have been cut quite a bit. So they're having to put out more and more of their money. Well, I think you can probably tell where I'm going with this story. We're already up to $900 a month. And she doesn't make a whole lot more than that on a monthly basis. By the time you look at health care, which of course most minimum wage jobs don't provide, and maybe that car breaking down, Mary's in trouble. She's in trouble of being able to stay in her apartment, but she's working full time. Now, I mentioned to you the kinds of jobs now that we're growing. We're growing those lower wage jobs rather than the higher wage jobs. And in fact, between that, even though we've increased our minimum wage, which has been terrific, by the way, it certainly has helped many, many people, it's not enough to meet all of the basic needs for family anymore. It was in the late 70s, but our expenses, our times have changed. Things that cost more have changed, and our wages have not kept up. Our minimum wage hasn't kept up. The minimum wage did, in the late 70s, provide above poverty wages for a family. Just barely above poverty, but at least it provided above poverty. That's no longer true today. So that income problem is definitely a big piece of why we have so much hunger. Now, Rachel talked a little bit about a child's ability to learn when they're hungry and how difficult that is. And in Oregon, nearly 23% of children live in food insecure households. That's a big number. That means they may be getting something to eat. Maybe it's not always the best food. Top ramen isn't going to help your brain cells grow very well, I'm sorry to say. And she talked about the numerous studies that show the link between learning and eating. And I also like to remind people of sort of that old cartoon that talks about for the want of a breakfast, an education was lost, a life was lost. All those things that person might have done, a cure, a new idea that would build businesses locally, all of those things we lose if we don't take care of those kids today. And so for me, although the whole family is important, I migrate towards the kids and the need to make sure they have adequate nutrition. And the tendency is, younger families with younger children tend to be poorer than families with older children. And so they're the very group we should be most focused on, and they're the very group whose many programs that help support their low-wage jobs are being cut out from under them. There's one bright spot, and that's the federal food programs. They're there, and we don't take as good of advantage as we could. We could do a lot better. One example, the food stamp program went down dramatically after welfare reform, and we, together with the food bank and others, raised some private money and got the state to run it through and get federal match. And over 3 years, with about I would say $600,000 between state, federal, and private dollars. We are now bringing in $192 million more dollars a year into the state in food stamp benefits. For a very small investment in outreach, we can do a lot to maximize federal resources that we're not utilizing. We still have a ways to go in food stamps. We could do the same thing with our child nutrition programs. We do pretty well with school breakfast and lunch. We could probably do a little better. But summer food, we only serve about 15% of the kids who are eligible. There's a huge opportunity there to bring in more federal dollars. And the after-school snack and meal program, we're one of the pilot states in the country, but we only have 23 programs. We could do a lot better than that and bring a lot more federal dollars in during these tight budgetary times. So these are the kinds of things that come to mind for me when we're talking about midterm solutions. We've got the emergency side, and Rachel's talked about how important that network has become, how much they're doing, and how they're stretched, because the private side can only do so much. We've got this midterm piece now, the federal food programs and what they can provide, and we know we could be better accessing those for a little bit of money put into outreach. We need to make sure there's a strong safety net in place for everyone. And that includes some other things that you don't necessarily always attribute to hunger. It's those child care subsidies and those rent subsidies. It's a couple of other things that I want to bring to your attention, and I think are particularly important in the midst of the budget crisis we're going through. Today you're going to hear about the new $240 million hole, which got leaked out a couple days ago, in the state budget. And legislators are tearing their hairs out trying to figure out how to fix that. Well, it occurred to me the other day that if it's true in terms of economic development that for every dollar you put into the community, you reap $2 to $6 additional dollars in economic activity. And a recent report came out from USDA showing it, yes, that's true with food stamps. For every dollar of food stamps that go into the local community, another $2 is generated in economic activity. Well, then the opposite must be true too. Every time you take a dollar out of the community, you're losing some other economic activity. And so all these budget cuts that we've been seeing happen over the last year are actually contributing to our continued shortfall every time we get a new report. So we take $300 million out, and there's $300 million we lose in federal dollars, that's $600 million. And so be conservative and say, okay, we're going to lose an additional $3, not the $6, of activity. We're up to $2.4 billion we've lost by cutting $300 million. And when you begin, then you figure 9% on that. We're about at what our latest shortfall is. Surprise, surprise. The point in what I'm trying to say is that we have to remember that economic activity and economic development comes in from many places. And government programs are not always the evil that we see them being. They create jobs, they create economic activity, and they certainly help provide that safety net for people who are trying to work full time and don't have enough to make ends meet. So last but not least, I want to mention an area that truly people don't think about when they talk about hunger, and that is the tax system. I'm bringing this up because as we look at why people are hungry and what it is that impacts them and their ability to purchase food, we've been noticing something very interesting. Did you know that the bottom 20% who lost that 14% in purchasing power is also taxed at the highest rate between state and local taxes, percentage-wise? They pay more in percent of their income than anyone else in our state. In fact, a family making poverty wage jobs, family of four at $18,000 a year, pays $300 in state taxes. Now, why are we making them pay $300 in state taxes? They could use that money to feed their families, and they should be able to. It wouldn't be that hard to raise the bar. And this is one idea that we've put into the legislature along with some other modest food proposals. Raise the bar. It raises it for everybody, so let's put a top tax rate on that there. I lose a lot of people there. Red flag, oh no, another top tax rate. But they're getting the break at the bottom, remember? So people who are making poverty wage level wages do not pay state taxes. We're one of the very few states that still taxes people who are making poverty wage jobs. So that's one idea. Another has to do with renters' tax credit. I just want you to think about the fact that there are tax policies that impact families' abilities to purchase food and provide for their families. We'd like to see that stopped. We'd like to see that as a piece of the safety net for people making low wage jobs. Now, solutions. I mentioned the federal food programs. We have some state options. We're very happy the governor is looking at hunger as a major issue and calling business leaders and others to the table to look at it. We'd like to come up with a series of short, midterm, and long-term solutions. Rachel has lots of ideas from the food bank. So you know that you can come to our two organizations for more information on how to help and how to plug in to any of those areas. I just want to raise, before leaving, two areas where people might be interested in plugging in. One's at the federal level. We have a lot of things going on at the federal level this year. There are some changes to Medicaid and also to the welfare program that could impact our poverty and hunger rate in the state. Get involved. Make sure that the reforms there are positive reforms that help people. And then at the local level here in Portland, the summer food service program is kind of shaky at this point. Portland Public Schools has done a wonderful job of providing summer food to kids in the Portland area for the last 30 years. But with all of the budget crisis going on at Portland Public Schools and wondering if they're going to cut 5 weeks, now it looks like maybe we're going to get them back, and not knowing if there's going to be any summer programs, their food service is not sure they can run a program that will break even this summer. They can't guarantee it because it's still uncertain what's actually going to be in place this summer. We're working with a number of people in the community to try to find a pot of money to help underwrite that program so they don't have to quit being a sponsor and kids don't get summer food. We're also looking at whether there are other sponsors in the area. There's something you can get involved in right now, today, here in the local community. And I offer that to you because I think oftentimes we can get very overwhelmed with the enormity of really the solutions, which are living wage jobs and affordable housing, ultimately. So remember, I mean, we can point to what's happened with Portland Public Schools. People cared enough that they came together and they found a way to add back those weeks. Now, it was hard work, and nothing that is really worth something is easy work. It's hard work. But remember that in all of the information that Rachel and I have given you today, that anything worthwhile takes work, and we can do it if we're committed to it. And there's one other reason why I think we should be committed to it. It's a quote that I've used many times from Bishop Theldon May. And he said that there are many of the things we need that can wait, but the child cannot. To this child, we cannot answer tomorrow. This child's name is today. Thank you very much.
I'm quite overwhelmed by your presentation and the number of both the problems and the possibilities seem quite extensive. I was trying to think of how a tax reduction in the dividend tax might help this situation, but I won't ask a question about it. Let's see. Let's focus on the next 2 years. Let's say that you're with the governor and he's asked your advice, and he is a friend of children, and he asks you, what can we do in the next 2 years? What are your priorities for the next 2 years to help children around the issue of food and hunger?
Our first priority would be to get everyone that is eligible onto the food stamp program. The federal food and nutrition programs really are our greatest leverage point. And the estimates right now are if everyone who is eligible for food stamps were on food stamps, it would bring $20 million a month into Oregon's economy that be spent on food in our grocery stores, and as Patty talked, the trickle-down effect in terms of the economy. Food stamps, expansion of summer food, now only something like 20% or 25% of kids who are eligible for free and reduced price lunch have access to a lunch program during the summer. That's another big pressure. We see our numbers go up. Anytime the kids are on school break, whether it's in the winter or in the summer, having, five more meals a week to have to provide, particularly to the teenagers, puts real pressure on the family budget. So federal food and nutrition programs, we could make some big improvements in the next 2 years.
I would add the big big picture since Rachel added my exact sentiments in terms of federal food programs, and that is that our legislators take the bull by the horns and really look at our revenue situation in Oregon and revamp it so that it is more fair and there's enough money to provide the basic services that our families need.
I'm Carol Witherell, City Club member, and thank you both for a very informative and hopeful in many ways presentation. And I guess my question has to do with the hopeful part, because as we look at schools and the hunger issues in Oregon and the national publicity that we have about each, unless we find a really aggressive, hopeful place to work from as citizens, as a legislature, and stop the blame and find the path that allows us to give a different message to our children, our families, our school folks, and the rest of the world. What can we do to get to that place? What can citizens do to really mobilize and help that message get out and break the mistrust and the blaming and the hopelessness?
Sorry, I answered
I
loud.
gotta go first. Well, I tend to be a very hopeful person myself. I tend to be an optimist, and I'm happy to see we have a governor who's an optimist too. That doesn't mean that you ignore the important and difficult questions, but it does mean you operate from a different place, and that is where we do have respect for each other. I really think it's easy for me to get very upset with people who think very differently from me, and there are a lot of people way on the other end of the spectrum from me. But they have legitimate points, and I think if we can operate from a place of respect for each other and call on our state, on everyone, to start respecting each other instead of ripping each other apart in terms of their ideas, I suspect there's more middle ground there than any of us realize if we would just let go of some of those ideologies.
Thank you.
Claire Kardowski, City Club member. Thank you for presentation today, Rachel and Patty. My question is, how do you determine which states are the hungriest?
The ranking comes from a study that was originally commissioned by the U.S. Department of Agriculture to try to get on top of the issue of hunger and food insecurity. Patty's going to remember all of the universities that were involved in developing the survey instrument, and I'll let her answer that detail. The survey is part now of the census survey and the annual population survey. We believe that the results of that survey are actually pretty conservative estimates because it is a telephone survey. And we know that a lot of people that are turning to our network don't have telephones. But it asks a series of 18 questions around a household's ability to purchase the food that they need for their household, to have choice. Do they worry about food? Do they know where they're going to get their next meal? Have the adults in the household skipped meals? And have they had periods where not only the adults but the children have gone for a 24-hour period without meals? And it is that figure where Oregon's food insecurity with hunger is double the national average. 6% of our population, it is estimated, that are actually going without any food at all.
For some
Period
point of time in the month. The survey was created along with help from USDA and the Center on Disease Control and a number of prominent universities. And families have to answer 6 of the 18 questions in a certain way in order to be classified as hungry. So they don't just take it from one single question. It is a compilation of their answers that determines that. It's the same survey used everywhere, and actually they do, from the random sample, if they don't get a response by phone, they do go out and do personal interviews. So there is that element. It's the state population survey that's phone only, but the national one that we get our ranking from does go out and visit families. It's only been around since 1995, so we can't go back to the early 80s. I wish we could go back to the late 70s when, in my view, we had a much better safety net in place to see how we were then, but we can't, unfortunately. We just have it since the mid-90s.
Jay Formick, City Club member. Rachel, I wish I could wish you a happy anniversary. I'm just sorry that you haven't worked yourself out of a job in the last 20 years. Notwithstanding Carol's jump towards optimism, I have a growing sense of dread about the future. Things are not settled, obviously, in Salem yet, but the trends I see seem to suggest a rollback in the basic level of support for people living on fixed and low incomes. Now, it would be all well and good when the economy turns around and there are plenty of jobs to be had, but for seniors and disabled people, it's irrelevant. For them, a basic level of support is going to be necessary forever. They can't go and get a job at McDonald's and start, paying a higher rent or making any kind of changes like that. I want to ask you, Rachel, and Patty, you as well, what's your forecast for that population as we come out of this economy?
To tell you the truth, I have a hard time thinking about it. As my husband and I talk about at home, it feels like Armageddon. I think that as a society, we really are going to need to come together and vote our values, and that we need to be, I feel like we've lost our values in this society, and I think there needs to be a rising up of those who share our value, that food is a basic human right, that our kids need to be taken care of, our sick need to be taken care of, the elderly, because the forecast is it's only going to get worse. I walk with a cane. My parents had to be in a nursing home for a while last year, and to see what kind of care is available in the boom times is very, very scary. I got a letter from a gentleman. It is Mr. Whitney Bates, if you would identify yourself for me. Mr. Bates wrote me a lovely letter that came this week, Tuesday, saying that, and he made a contribution to the food bank, $57. He was also sending $57 to the Department of Human Services. And he asked that I speak up today about a voluntary surtax, and that he has made a commitment as an individual to give his extra 1.5%. And I think, here in Multnomah County, of course, we said we're willing to do that, and I think we need to follow through. Maybe it needs to go into the state coffers. There are those who have such great level of mistrust and disdain for state government and government waste. But let me tell you, people think food drives is where all of our food comes from, but it's not. It's this much of where our food comes from. The largest food drive of the year is the State Employees Food Drive. And part of the reason it's so successful, 2 million pounds of food, is because so many of those state employees qualify for food stamps and food boxes. I guess I still have hope that we can turn things around, and that values about human dignity and caring for those in need is a priority.
Let Whitney be our model.
Let Whitney be our guide.
May I fumble to the mic and say something?
Yes, Whitney.
I think I've discovered, I want to confirm this before I put it in writing, that contributions to any state agency or local government are among those things which are tax deductible. Now, My checks will clear even if they're not. I know as a food bank they are. I asked Patti Whitney-Wise to let us know whether she's deductible or not. I
Yes,
even
we
cited
are.
an old non-existent New Yorker cartoon. Madam, are you deductible? But I don't direct that. You see, that's a reference to a cartoon. That has nothing to do with Patti. But I'll be in the press soon with my analysis.
My Episcopal priest husband who's sitting here today would like to know that that's not the case. May I just offer? I'd like to issue one other challenge because I know each of us can do it individually, but many people were misled before the vote on Measure 28 by certain individual leaders saying, oh, the money's there, we'll come up with it. And it was a spoof. It was a lie. And yet we still got 46% of the vote statewide. I think that's enough to go to our legislators and say, look, without that spoof, this would have passed. You need to just be leaders in Salem, and you need to pass a tax increase.
My name is Monroe Sweetland. I'm a has-been.
No.
Oregon
From my neck of the
politics,
woods,
a lot of
Milwaukee.
other respects. But I wanted really to ask, in order to qualify to get to the mic, I had to have a question. Have you read your Oregonian's editorial page today? Our great editorial writer in the Oregonian, my age disqualifies me now. Anyway, today, what's his name?
David Saracen.
Oh, yes. Oh, sure. How can I forget it for him? Dave Saracen has a splendid editorial today summarizing much of what we've heard here today. It couldn't have come more propitiously. I probably wasn't by accident. But please do note your own Oregonian. I have up to 100 copies of this for free distribution for anybody that would like to take them with you. And this gives us something to work on, although you will see ways in which he even praises our Republican U.S. Senator for what he's been doing, and he justifies it very well, it seemed to me, in his points. He points out, too, that we have two senators who are trying to help in Washington, are working together on these particular issues. If that isn't so, we better know it, because it looks as if they are succeeding in doing that. We have a governor who's very much helped to bring the agenda to the top of the table, and I think we'll find a useful tool in the editorial in today's Oregonian. That's my question, if it qualifies.
Thank you. Next question.
Hello, I'm Abraham Mubarak, co-founder and spokesperson for Dignity Village. I was listening to you say about people with addresses, how they getting fed, but I was wondering, we at Dignity Village, we have an address, but what about the invisible homeless person, the person that's sleeping in vans and in cars or in basements or in garages? How would they get fed?
The most frequent source for those folks is through the soup kitchens. Here in the Portland area, there's a lot of availability for food, and you'll often hear you can be pretty well fed if you live in downtown Portland. But you get outside of downtown Portland, and that's not true. It's a much bigger problem in other more rural parts of the state. Our network of agencies, part of our agreement with their membership, is that people do not have to prove residency in order to get assistance.
Now, another part to that, contrary to the popular belief that people do work at Dignity Village, but like you said, they had to subtract one thing, either housing, food, or clothing. We have a mother and son Eunice and Eddie Walser, she's 57, he's 30. They have an income, but they want to go to college. They choose to move to Dignity Village, and they just graduated from Western Business College. So with that diversity and trying to budget to eat, that question again, how these people, the quality of faith.
And I think that really points to what's happened with our disinvestment in affordable housing, because we should really be helping people like you are speaking about in Dignity Village to have a place to live while they're working on their education and not have to choose between basic needs.
Andy Lenahan, City Club member. We've heard a lot about the high level of hunger in Oregon. We've also heard some statistics suggesting that Oregon may have one of the highest obesity rates in the western U.S. And I wonder if you could talk about the connection between those facts.
There's a phenomena that happens when you're hungry, or when you're on a diet for that matter. Your body shuts down to a certain extent. And so when you start eating again, it doesn't take as much to gain weight because you're conserving energy. It's a medical phenomenon. And for a lot of people who are hungry on a cyclical basis, that is happening to them constantly, as opposed to if you're eating normally all the time, your body's at a certain energy level. But it's that mechanism to survive. And couple that with the kinds of foods that you may have access to. Rachel mentioned top ramen. That's extremely high in calories. It's not particularly healthy, but it fills your stomach up. So some of that is not a surprise. It's actually a medical phenomenon that makes sense if you actually look into it. Obviously, there are other pockets that are obese too, and it's not limited to low-income or poor or hungry people. We do need to take a look at what we're eating overall and how much exercise, which is the other very big piece. And I'll stop there to let Rachel respond as well.
Yeah, it's certainly the obesity problem is not related solely to income. It really is related more to the amount of processed foods that we all eat here in America. And low-income people see the same advertisements as everyone else. And in fact, if you're a stressed out mom with 3 screaming kids and wondering, whatever the next issue is, where every day is about crisis and survival, the 29-cent hamburger at the drive-thru that quiets those kids may be the best use of that dollar. And when you don't have access to food that you would choose to eat, you're going to stretch that dollar just as far as you can, and that means a lot of unhealthy foods, a lot of pastas. But again, that's not. Their obesity is a big problem of people with much higher incomes as well.
Look, City Club member, I'm beginning to sound like Ray Pallotti in his transportation, but I do not understand why we don't realize that we'll never get a sales tax until we sit down and completely reform the entire tax structure and give some carrot while we put on the ballot a sales tax so that people will get a net profit, if you want to call it that, by paying less property tax, less business tax, less whatever it is, and take all the taxes we have, the needs, after a thorough looking at the administration costs and accountability, and put it on, don't put it on as a sales tax, put it on as a luxury tax, and exempt food, shelter, and clothing.
I would agree with that absolutely, and while, I'm one of those Oregonians who's actually changed her mind about sales tax, and part of the reason for that is we do have sales tax. It's on beer and cigarettes but it's not on wine and cigars. And basically, I agree with you, Ned. That's we should call it a luxury tax. And when we've mentioned a little bit about the governor taking a leadership role on hunger, and that's the element that I've been most encouraged about. Is, while he's going to do the bully pulpit and get everybody thinking about hunger and keeping food moving through the charitable system to deal with the immediate need, his promise is about looking at the tax structure and how do we bring in business that not only is able but willing to pay family wage jobs, and that, I think that's our only hope for making our way out of this.
Joe Barthmeyer, I'm with Social Venture Partners. Coincidentally, there was a report on this morning at NPR on this topic of states not getting all the federal dollars for food programs that they could, and they cited an example of, I think it was after-school programs, where the feds will donate all the food, but the schools or other parts of the infrastructure need to be there. So my question is, are we doing enough here in the state? Is there some way or other we can stimulate the schools or whatever bureaucracy it is that is needed? Is there anything that outside organizations and private citizens can do to somehow or other open up the gates and get more of the food in here? What can we do?
Thank you, and I didn't plant you in the audience. That's been something that's been very near and dear to me for a number of years. We've shown how to do a very good model of outreach with food stamps that have brought in lots of additional federal dollars. We can replicate that in child nutrition. We just need some groups to come forward to help fund the outreach, and we can find the people to sign up for the program, I guarantee you.
Ron Cease, I'm a member of the City Club and a member of the board of the food bank. One of the additional negative pieces, I understand that the recent meeting that the president had with the governors, he told them that as far as state economies, you're on your own. He'll take care of the federal economy insofar as he's taking care of it. And the states will have to take care of their own economies. The papers then say that the state and local governments are suffering the worst economic situation in 50 years. And I think you can see it at the state level. I would agree, it seems to me, in terms of my legislative experience, that you need to be working on the tax issue all the time. At some point, I don't know when that'll happen, there may be a change. And in the short haul over, it seems to me the most pressing issue is in finding more food, more donations, more volunteers, dealing with the summer lunch program and all of those things that can be done right now. Rachel has used a figure that says every dollar that food bank gets, it's worth about $10 in food. So it gives you an idea. If you give $10, it's worth about $100. So those things are going on all the time. But you're right, it's not just food. Look at what's going to be happening to the health plan before they're done. Now, as far as legislators, I know it's very difficult to be sympathetic at times. But I know there are people in Salem. You got that from Senator Courtney when he talked here the other day about how they're hurting. They're bleeding inside. Those that care. There are obviously some that don't care. But we are in a real terrible pinch financially in a way that I've never seen. But in the meantime, work on their taxes, work on all of these things, but don't give up the short haul because people need to be fed.
Is this your birthday, Ron? Ron Cease, is this your birthday? Monday. Well, happy birthday. I heard a little commotion over there. Thank you. Thank you. That wasn't a question, but it was very, very well stated. Well, that's okay. We're out of time. I think that we are out of time. I'm sorry, but I want to close with what I heard both in the introductions and from these two women. I think that you are an incredible gift to our community, to our state, and I want to thank you so much for what you do. This was an excellent program. City Club is adjourned.